Do you know what osteoporosis is and how it affects your body? Picture the structure of a healthy bone. It's dense, strong, and capable of supporting your body's weight. Now imagine that bone becoming porous, like a sponge. This is what happens in osteoporosis. The bone loses its density and becomes fragile, prone to breaking from even minor falls or, in severe cases, from simple actions such as sneezing or bumping into furniture. Osteoporosis is a silent disease, often revealing itself only when a fracture occurs. It's a global health issue affecting millions of people across the world. Understanding osteoporosis is not just vital for those at risk, but for all of us. Because the more we know, the better we can support those living with the condition and work towards prevention. By the end of this video, you will understand the causes, symptoms, and treatments of osteoporosis. But what causes osteoporosis? Is it age, diet, or something else? Well, the answer is not quite as simple as one might hope. Osteoporosis isn't caused by just one factor, but rather it's the result of a mix of several elements. Age, hormonal changes, certain medical conditions, and lifestyle choices like diet and physical activity all play significant roles. Let's start with age. As we grow older, our bodies naturally lose bone density. This process begins around the age of 30 and accelerates as we move into our 50s and beyond. Consequently, older adults are more likely to develop osteoporosis. Hormonal changes, particularly in women, also contribute to osteoporosis. Women experience a significant drop in estrogen levels during menopause, which can lead to increased bone loss. Men, too, can experience bone loss as testosterone levels decrease with age. Certain medical conditions can also increase the risk of osteoporosis. These include autoimmune disorders like rheumatoid arthritis, endocrine disorders such as hyperthyroidism, and digestive diseases like celiac disease. Even certain medications used to treat these conditions can contribute to bone loss. Now let's talk about lifestyle choices. A diet low in calcium and vitamin D can contribute to weak bones. Both these nutrients are essential for bone health. So if you're not getting enough of them, your bones may become more susceptible to osteoporosis. Physical activity, or rather the lack of it, is another lifestyle factor. Regular exercise, especially weight-bearing and resistance exercises, can help to maintain or even increase bone density. On the other hand, a sedentary lifestyle can lead to a decrease in bone strength and density. In essence, osteoporosis is like a jigsaw puzzle, with each piece representing a different cause. Understanding these causes is not just crucial for those already diagnosed with osteoporosis, but also for everyone else. After all, prevention is always better than cure. Knowing the causes of osteoporosis is the first step to prevention and early detection. So, keep these factors in mind and take proactive measures to ensure your bones stay strong and healthy for years to come. Now that we know the causes, what are the signs that someone might have osteoporosis? Osteoporosis is often referred to as a silent disease. Why? Because one might not even realize they have it until they experience a fracture or a drastic change in posture. That's why it's crucial to understand the symptoms. One of the most common signs of osteoporosis is back pain. This pain can be due to fractures or collapsed vertebrae. As osteoporosis progresses, these fractures can lead to a stooped posture, often referred to as a dowager's hump. If you find yourself having unexplained back pain, especially if it's severe or persistent, it might be time to talk to your doctor about osteoporosis. Another key symptom is a loss of height over time. As the bones in the spine weaken and fracture, it can lead to a loss of height. You might notice that your clothes are longer than they used to be, or that you have to reach up more to get things off the high shelves. It's a subtle change, but an important one to be aware of. Frequent bone fractures are another telltale sign of osteoporosis. These fractures can occur from minor falls or, in severe cases, from simple actions like sneezing or bending over. If you're experiencing fractures more often than seems normal, it could be a sign of weakened bones due to osteoporosis. It's important to note that these symptoms often go unnoticed until a bone breaks. That's why it's so crucial to pay attention to your body and keep an eye out for these subtle signs. Remember, osteoporosis is a progressive disease, meaning it worsens over time if left untreated. But don't let this information scare you. Instead, use it as a tool to stay informed about your health. The more you know, the better you can protect yourself and your bones. Being aware of these symptoms can lead to earlier detection and treatment, potentially saving you from severe complications. So, let's stay vigilant and proactive about our bone health, shall we? If you suspect you may have osteoporosis, how can you be sure? Well, it all begins with an open conversation with your healthcare provider. Share your concerns, symptoms, and any risk factors you might have. They'll likely recommend a bone density test, also known as a DEXA scan, as a next step. This test measures the amount of bone mineral content in certain areas of your body, typically the hips and spine. Now, you may be wondering, what is this DEXA scan and how does it work? Think of it as a highly sophisticated scale, but instead of measuring your weight, it gauges the strength of your bones. The device uses a low dose of ionizing radiation to create images of the inside of your body. These images then provide data about your bone density. The good news is that this procedure is painless and non-invasive. You won't need any special preparation, and it takes less than half an hour. During the scan, you simply lie on a comfortable table while a machine arm passes over your body. Once your healthcare provider receives the results, they can determine whether your bone density is within the normal range. If your bone density is lower than normal, you may receive a diagnosis of osteopenia, which is a precursor to osteoporosis. If it's significantly lower, you could be diagnosed with osteoporosis. The bone density test is a crucial tool in diagnosing osteoporosis, as it can identify the disease even before a fracture occurs. It can also help predict your chances of fracturing a bone in the future and monitor your bone density over time. Remember, osteoporosis can be a silent disease, often showing no symptoms until a fracture occurs. That's why it's so important to be proactive and seek a diagnosis if you're at risk. Early diagnosis is key in managing osteoporosis and preventing fractures. So don't hesitate to discuss your concerns with your healthcare provider. It's your first step towards better bone health. So, you've been diagnosed with osteoporosis. What are your options? Well, let's dive into the myriad of treatment options available for managing osteoporosis. It's important to remember, though, that the most suitable treatment for you depends on your individual health condition and should always be decided in consultation with your healthcare provider. First off, there are several medications available, including bisphosphonates, which help slow down the rate of bone loss, and hormone-related therapies, which can help maintain bone density. Your doctor might also recommend calcium and vitamin D supplements to ensure your body has the necessary nutrients to build and maintain strong bones. But it's not all about pills and supplements. Lifestyle changes play an equally, if not more, crucial role in managing osteoporosis. A balanced diet rich in calcium and vitamin D is fundamental to bone health. Incorporate foods like dairy products, green leafy vegetables, and fish into your diet. And don't forget about regular exercise. Weight-bearing and muscle-strengthening exercises help build bone density and keep your muscles strong, which can prevent falls and fractures. Physical therapy is another beneficial treatment option. A physical therapist can guide you through exercises that improve your balance, flexibility, and strength, reducing your risk of falls. They can also teach you safe ways to move and lift objects to protect your spine. Let's not forget about the importance of quitting unhealthy habits such as smoking and excessive alcohol consumption. These habits can lead to bone loss and increase your risk of fractures. Finally, remember that managing osteoporosis is not a sprint, but a marathon. It's about making consistent, lifelong changes to your lifestyle and diet. It might seem daunting at first, but small, gradual changes can have a big impact on your bone health and overall well-being. With the right treatment and lifestyle changes, you can manage osteoporosis and lead a healthy, active life. So take a deep breath, lace up those walking shoes, and step confidently into your journey with osteoporosis. You've got this. Let's recap what we've learned today about osteoporosis. Osteoporosis is a condition that weakens bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a minor fall or sudden impact causes a bone fracture. The main causes include hormonal changes or deficiency of calcium and vitamin D. Age, genetics, lifestyle choices, and certain medical conditions can also contribute. Symptoms are not always apparent until a bone fracture occurs, but might include back pain, a gradual loss of height, or a stooped posture. Diagnosis usually involves a bone density scan, also known as a DEXA scan. This can help determine your risk of fractures and the severity of your osteoporosis. And treatments, they range from medication to lifestyle changes, focusing on diet, exercise, and fall prevention. Remember, knowledge is power. By understanding osteoporosis, you can take steps to protect your bone health and live a full, active life.